The opioid crisis has taken too many lives, but as a total number, we start to lose sight of who is being impacted by this tragic epidemic. To start a meaningful conversation about this topic, one of Magellan's own nurses, Janet Edwards, wants to share her personal story.
My daughter Nikki was a nurse and a mother, and she was 26 years old, and she died 3 years ago on June the 13th of 2014 from an accidental overdose of fentanyl. She came to me and she sat, at our kitchen table and cried and told me that she was addicted to heroin. I was in complete shock. She's beautiful, intelligent, a great mother, a good nurse. She loved caring for her patients. She was a good friend. She had many, many friends. My heart was just breaking, and it was just absolutely breaking for her. And she refused to get help because she was full of shame, and she was full of guilt, and she didn't want anybody to know. I know that when she was in nursing school, she was very driven, and she worked full-time. She was a single mother, and she carried a full caseload at school. And so she went to several physicians and was able to get any kind of medication that she needed to try to help her get through school. I was at work, and I received a phone call, and it was her friend that she was with at the time said that she quit breathing and they had taken her to the hospital. Cole was 6 years old, and he was there when Nikki quit breathing and was taken to the hospital, so he witnessed that. And when I looked at my beautiful daughter laying in that bed, I knew she was gone. When I think about the opioid epidemic and what all of the families are going through, families need support. They cannot go through this alone. And people with addiction, they need treatment, they need support, and it cannot be done alone. The case managers are reaching out to these members who are suffering from pain. Some of them may have an addiction to opioids, and they are letting them know that they're not alone, that there's someone who cares, someone who will support them and will help connect them to the behavioral health community and the needs that they need. My hope for our society is that we have more companies like Magellan that can reach out to these members who need help and help them live healthy, vibrant lives. I owe it to her, to take care of others. And I think if I can help one person, I've been successful.
Stories like Nikki's are happening to about 175 people every day. These are real people, people who you may interact with and not know that they have an addiction. Janet has turned a horrible situation around and focused her life's work on shining a light on identifying opioid addictions. She and thousands of others at Magellan are not staying silent. We are working diligently to find meaningful solutions to reduce stigma so we can get people the help they need to live healthy, vibrant lives.